Okay, so as my favorite comedian say, now for something completely different. I'm going to talk today about sexually transmitted hepatitis C. All right, we're going to be perhaps controversial here, but this is in a specific group of HIV-infected men who have sex with men. I'm going to talk about what is an international epidemic. So I was charged with describing what is known internationally, and then I'm going to tell you about our own work at Mount Sinai. But first, I just want to go through briefly to give you an example of the men I'm seeing here, and I think very, very similar to what we're seeing kind of world over in this epidemic. So 46-year-old HIV-infected man. He was a lawyer, lived in Brooklyn, which is right next to Manhattan, across the river, for those who are not familiar with the geography. So he had very recently acquired HIV infection, in fact, via men, having sex with men. He went to his first doctor's appointment where he had a standard evaluation. He had a CD4 count that was 427, quite good. His HIV viral load, 26,000. There it is. His hepatitis C antibody was negative at the time, and his liver tests were normal. So he said, you have asymptomatic HIV infection, come back and see me in 3 months. And he returned for the routine checkup in 3 months, felt fine. So what have you been up to? He said, well, I've been having unprotected receptive anal intercourse with many men. He didn't phrase it exactly that way. I'll tell you how the conversation goes. We can talk about that later. And he said, and I've been using crystal methamphetamine, cocaine, ecstasy, amyl nitrate, marijuana socially. So routine blood testing. His liver tests were now quite abnormal. The ALT, 960, almost 20 times elevated AST. And hepatitis C antibody was now positive. It was a genotype 1A hepatitis C. And this doc knows me and picked up the phone and said, can you see him? And I said, absolutely. So we observe closely for signs of spontaneous clearance, which are relatively unusual. I'll tell you about that in a minute. And it's something that we have done in our institution, it's an important thing that I'm going to come back to, which has not been done in most parts of the world, is a liver biopsy. And on this liver biopsy, the dark blue there is the periportal area that is fibrosis. That's collagen formation, and the diagnosis was stage 2 on a scale of 4, fibrosis. Now remember, this person did not have hepatitis C only a few months earlier. Okay, so what's new? Our patient, and through the epidemic in this, men who have sex with men is a risk group. All right, we have heard a lot in this meeting, and we'll hear more about really our traditional risk groups. And in fact, in the 70s and 80s, when HIV was spreading very rapidly through MSM, there was really no evidence of more hepatitis C transmission in this group of people. And in fact, in HIV-negative MSM, who don't inject drugs, the prevalence, depending on what studies you look at, between 0.3 and 2% prevalence in the U.S., which is basically similar to the general U.S. population. And that was true then, and that's true as recently as we've been able to look at it. So what's new? Injection drug use was not the mode of transmission in this person. It was through having sex. HIV was present before the hepatitis C, and so this is different than our currently, through injection drug use, co-infection usually happens in the other way, through needle use. And this person had significant stage 2 out of 4 fibrosis in actually the acute phase of infection. All right, so now backing up, at the time we were seeing this person, the epidemic had already begun to be reported in England and in France, in Holland, and in Germany. And these were just the earliest papers. Is by no means a complete reference for what was going on. So when we went to the literature, when we first saw our case, that's what we were seeing. And then subsequently, with the European cases shown, Europe is now one big star there. There were a couple of reports, one colleague in San Francisco, and then an Australian, again, reporting the same demographic and the same problem. I'm going to go through a few of what I think are sort of the more direct measurements of a couple things that we want to think about here. One is, well, how common is this? Well, I think it's not like the incidence rate for injection drug users, but yet it's pretty significant. So in a recent paper from the London and Brighton group, you can see just over the last few years, from 2002, the incidence has been increasing. And what they didn't trace back in this diagram was that there was really essentially none just a few years before. So the overall incidence now, this is per 1,000 person years, so it's just under 1. So that compares, it's only about 1/10 of what we're seeing in some of the injection cohorts. But yet it was a lot more than what was seen before. And you can see in Amsterdam, this is in a poster from this last year's meeting, that at this hospital there was really no hepatitis C in the patients, HIV-infected patients, and it was something that happened subsequently. Another paper from the Amsterdam group estimated the incidence more recently at about just under 1 per 100 person years. Okay, so in a really wonderful international collaboration that we were not part of at the time, a paper by van der Laar that was published recently, really mostly looking at the molecular looking at the virus, but there's some nice things you see in the summary here, that the ages across the different countries were pretty much the same. These are all men who have sex with men. Their CD4 counts in those who reported were all quite good, so their HIV infection was in good shape. About 2/3, 3/4 on antiretroviral medication, which actually means, as in our group, that some of the people were really so healthy they were not even yet on antiretrovirals. Injection drug use is very unusual, except in the Australia group who are following specifically an injection cohort as part of what they're doing. And the genotype, by and large, is 1A. There's some genotype 4, which is interesting. That was what mostly in the French were seeing at the time, but it's more widely disseminated now. So it did